It's time to talk about COVID-19 on my channel. I am almost certain I have not yet. And I want to talk about how COVID-19 impacts women and girls and how it is a feminist issue. I found an article on care.org titled 5 Reasons Why U.S. Women and People of Color Are Especially Vulnerable to COVID-19. The link, of course, will be in the description box. Anyway, it's a gender analysis they did on COVID-19 in the United States. We're talking specifically about the United States. I'm not an American, but I think this applies, regardless that the study is specifically about the US, I think it applies to most Western countries. So point number 1 says poverty and historic underinvestment of women and Black, Indigenous, and people of color communities intensify the impacts of COVID-19. Women are 35% more likely to live in poverty than men, and Native Americans account for 25% of poverty in the U.S., while making up less than 2% of the general population. 76% of healthcare jobs are held by women, almost half of which are women of color. Point number 2 says, a limited access to sexual and reproductive health care at a time of increased need is failing women. Sexual and reproductive health care, SRH, is losing ground as the pandemic drags on. Under normal circumstances, Black women are 3 times or more likely to die in childbirth than white women. The COVID-19 pandemic has impacted the designation of sexual and reproductive health care services as non-essential, and many are struggling to access appropriate health care when it's needed most. So, in a regular situation, Black women are 3 or more times likely to die in childbirth than white women. That's in a regular situation. In a pandemic where healthcare services are being redeployed to focus primarily on COVID-19 pandemic, means that number is going to increase, with the lack of resources being directed to sexual and reproductive healthcare services. Essential workers, point number 3, who are disproportionately Black, Indigenous, and people of color, women, hold more dangerous positions that threaten their economic security and health. We depend on these essential workers now more than ever: nurses, grocery store employees, delivery workers, farmers, mail carriers, much more. Black, Indigenous, people of color represent 40% of essential workers. Further, women make up nearly 67% of the workforce in the 40 lowest paying jobs in the U.S. These people are being asked to take the greatest risks in COVID-19 despite low wages and few protections. Okay. Yeah, 67% of the workforce in the lowest 40 paying jobs in the U.S. are women. Okay, point number 4. Unpaid caregiving is falling hardest on women, especially women of color. In the U.S., women take on the greatest caregiving burdens in the best of times. With families spending more time at home during lockdowns and most children home from school, increased caregiving burdens are hitting women the hardest. For single-parent families, 66% and 44% of which identify as Black and Latin, these additional impacts are further intensified. Point 5, increased stress and anxiety due to the pandemic means higher rates of violence on women and Black, Indigenous, people of color. In the U.S., 1 in 4 women are estimated to experience violence from a partner, and on some reservations, 1 in 2 Native women report experiencing sexual violence. For communities already marginalized due to immigration status, racial or gender-based discrimination, and criminalization, this combination of violence, increased risk of exposure to infection, and exclusion from healthcare access is a major concern. This report confirms that while COVID-19 affects everyone, it is not equally so. So I think that's a great thing to take into account, especially in this bizarre, particularly American, but it does happen here in Canada too, this whole anti-mask thing. There's been anti-mask protests. I see social media posts of people like complaining about masks, or people going to like people going to legislature buildings to protest having to wear masks, because many cities are passing like interim bylaws declaring that masks are mandatory in public places. Wearing a mask is a feminist act. If you are a feminist, you should be wearing a mask when you leave your home. We know that not only the actual virus of COVID-19, but the impacts this virus leaves on communities are disproportionately affecting women of color, women and girls of color. So to not wear a mask, to complain about wearing a mask, is absolutely anti-feminist. It's anti-woman, and I'm not going to say that it's racist. I am going to say that it gives way to the reality of white privilege when people are complaining about having to wear some fabric across your face for a little while, which ultimately is going to benefit you too in the end, but like it's about keeping other people safe as well. And when you are putting up a stink about wearing a mask, to me that says you don't care about women and girls less privileged and less fortunate than you. Point blank. Violence against women of color is disproportionately high, as is, and in the pressure cooker of pandemic stress, health stress, lockdown stress, that violence increases. The longer this pandemic goes on, the longer we're all going to suffer, but the longer and more exponentially so, women and girls of color are going to suffer. Put a damn mask on.